What if there was a phone app that changed your doctor's visit with just one click? And this one click gave you accurate, timely, and reliable data. Ta-da! ihealthp. But before I tell you about ihealthp application, let me tell you a few things. Approximately 1 in 3 U.S. adults are diagnosed with high blood pressure. In 2011, the U.S. spent nearly $46 billion in healthcare services, medication, and lost wages associated with this preventable condition. With iHealthBP, we can enable users to take control of their health by remotely monitoring their own blood pressure and teaching them how to prevent or control this condition, greatly reducing the cost for overall health care related to this condition. iHealthBP has been created to improve the delivery of healthcare by giving users the ability to collaborate with their healthcare providers to take control of their own health outcomes. The amount of possibilities can be endless, and patients who have high blood pressure, low blood pressure, diabetic, hypoglycemic, or suffer from heart disease have the control of their health with just one click. Patients can send information to their doctors without the stress and anxiety of frequent doctor visits. And please note, under the U.S. FDA guidelines, iHealthBP is considered a medical device. Therefore, iHealthBP is subject to additional regulations under the Food and Drug Administration. This is not just your ordinary app where you record data and your doctor thinks you've been training for the Chicago Marathon. iHealthBP uses accurate measurements to reduce errors and increase the accuracy of data for physicians to analyze. iHealthBP application includes an external finger cuff that collects users' blood pressure information. This information is transmitted to the user's mobile device via Bluetooth technology. iHealthBP contains a centralized dashboard which links the users to the application features. This includes data collection, individual data charts and graphs, personal profile, which we will talk about, calendar reminder, and alerts. iHealthBP converts user data into easy-to-read graphs to allow patients to view their blood pressure data and pulse information. By creating easy-to-read graphs, users are able to see trends or patterns that may exist while tracking any progress made by their lifestyle changes. Data charts and graphs can be converted to text, email, or PDF format to easily send information to healthcare providers. This chart shown here shows 1 week of BP recordings, taken twice daily, and this information shows how the graphs can be charted easy. Users will also get a personal profile, and they are able to enter their information, which includes height, weight, various medications, and if they are pre-hypertensive or hypertensive. Users can also enter health goals. Maybe you're thinking about losing some weight, or you want to exercise a little bit more. iHealthBP will help you with this process. iHealthBP even includes a diet and exercise tracker that shows you your healthy habits. The app sends daily reminders to make sure you're making good diet choices and that you can possibly lower your blood pressure with the combination of exercise and healthy eating. The app also contains a variety of alerts that allow you to stay in control of your health. iHealthBP can track doctor's appointments, send reminders when the appointment is coming up, send alerts to your physician when a reading requires medical attention. Physicians can directly call you to set up appointments or communicate any further treatments they see fit. iHealthBP also contains a variety of alerts that allow you to stay in control of your health. iHealthBP can track doctor's appointments, send reminders when the appointment is coming up, send alerts to your physician when a reading requires medical attention. Physicians can directly call you to set up appointments or communicate any further treatments they see fit. Please note that iHealthBP is not a substitute for a doctor. So if at any point you are feeling ill, please go to your healthcare provider. Our patients at iHealthBP is our number one priority, and we take your information very serious. iHealthBP is password protected and compatible with Touch ID technology. All user data information within iHealthBP is encrypted. Remote access is available to users, enabling them to wipe all information from their iHealthBP account if the device is ever lost or stolen. The app logs out after 30 to 60 seconds of inactivity, depending on the user's preference. There are no screen alerts for medication, so you can feel very secure. The app also requires a 4-digit password to view alert information. So now we can take a look at the design of the app. We have the creator, Mike, who will take you through a visualization of iHealthBP.
The iHealthBP app features an easy-to-use layout that allows users to create their personal profile. The personal health profile features information such as height, weight, blood pressure, health goals, and medications. The calendar can be used for reminders and alerts, and to capture medical appointments, daily health targets, as well as blood pressure measurement reminders. The user can easily communicate with their healthcare provider through the Contact Provider link that allows for messaging and appointment scheduling. The blood pressure capture allows for biometric identification and linking with the external finger cuff to capture the user's blood pressure and heart rate. The iHealthBP application features a suite of iHealthBP tools which track activity, dietary intake, and blood pressure data. These reports can easily be shared directly with your healthcare provider.
Now, let's talk about what makes iHealthBP different. There's thousands of apps out there, but what makes this one different? Let's look. iHealthBP will provide a 24/7 live support team to answer and assist with any functionality questions or concerns. And security will always be our number one priority, and we will ensure that all data is secure. iHealthBP app will help users to create error-free and accurate information, which will provide quicker and efficient information to give to nurses and doctors, which will essentially improve the quality of patient care. iHealthBP will allow users the ability to export their information, which can be used for clinical trials. Researchers will have the opportunity to ask users to participate in clinical trials. The data can also be stored in electronic health records. iHealthBP also takes advantage of telehealth. By allowing your doctor access to your data, physicians can consult you via text, FaceTime, or phone to discuss any concerns. HIT leaders believe that trust and quality are the main barriers to widespread adoption of mobile health apps. That is why iHealthBP has undergone rigorous testing and validation processes to ensure patients realize all the benefits of a mobile health app, such as improved patient-physician relationships through shared health management by providing useful, validated, quality patient data. iHealthBP is here to improve health quality by implementing accuracy, privacy, and data security. It is only one click away.